So welcome to a webinar on an auspicious day, March 11th, which marks the second anniversary of the declaration by WHO of the COVID-19 pandemic. It also marks for many of us the start of a period of extraordinary uncertainty, change in our lives. Each person has a story of how they have lived the COVID pandemic, one that many of us will tell to our grandchildren or even our great-grandchildren as time passes. So today's webinar is very much a retrospective on what we have learned, because a special partnership on March 11th, 2020, decided together to reflect together, to follow, to analyze the religious contributions, the religious impact on the COVID pandemic and the impact of the COVID pandemic on religious communities all over the world. So that is our ambitious menu for today. So let me first introduce what we're going to do and then highlight some of the housekeeping details. First of all, I think I should make clear the partnership that's involved. There were essentially three people, Olivia Wilkinson, Dave Robinson, and myself, who leading up to March 11th last year, thought that we needed to keep a close eye on what was happening on religious sides, partly because that is so often neglected. So Olivia, representing the Joint Learning Initiative on faith and local communities, the Berkley Center at Georgetown University, which focuses on religion, peace, and world affairs, and the small NGO that I lead, as well as being part of the Berkley Center, the World Faiths Development Dialogue. So we agreed, the three partners, that we would follow the pandemic from the religious perspective, really then with almost no idea of what lay ahead for us. But let me come back to the housekeeping. First of all, this is being recorded and it will be available on the websites of the organizations in a short time. We also have interpretation, French, Spanish, Arabic, and French, Spanish, Arabic, as well as English, of course. We encourage you very much to use the question and answer icon to pose any questions. So that's the housekeeping details. The meeting itself, the webinar itself, will be basically divided into two parts. First, we will have some reflections about what we're learning. One of my admired journalists commented that anyone who predicts what's going to happen in this time is a fool or a charlatan. So we're not predicting the future, but we will reflect on what we have learned over the past. I will start, then Olivia Wilkin, then Peter Yaboa from the Christian Health Association of Ghana and the Christian Health Platform will reflect from where he's sitting on how he has lived and what he sees from this. And then Olivia Wilkinson, for whom it is very early in the morning in Oregon, will look particularly at the research. So that's the first part. Then we'll turn over to a new website, which we have constructed with support from the International Partnership on Religion and Sustainable Development, PARD, and DSSW, and reflect on what is in it, what the project itself, as we describe it, has involved, how to use the website, the repository, as many of you will want to find the information that is in it. So that's the plan. We'll then turn to question and answers and see how many of them you have. So with that, I will now turn to my own reflections on what lessons we draw from this. And I want to start with the basic underlying question, which is the roles that religious institutions in all of their infinite variety have played in this extraordinary pandemic emergency across the world. All different religious institutions of all kinds in every part of the world, because the COVID pandemic has been like a storm that has affected every corner of the world, but often in different ways and at different times. We're interested in what the religious institutions have brought distinctively, with the trust that people have in them, their ubiquitous presence, their particular spiritual mandate, their historical roots. All of those have been an important factor in this pandemic. And again, the partners came to that because we had worked on other pandemics in the past, looking at the religious dimensions, the Ebola, Zika, HIV/AIDS, malaria, tuberculosis, etc. So that's the basic question. What has been the roles of religious institutions across the world, all of them in all of their variety? So there are basically 6 categories of areas that we have been tracking and where we have come to many conclusions. The first obvious one came with March 11th, 2020, which affected gatherings and therefore community. The first thing that happened initially to flatten the curve was the imposition of restrictions on coming together, on travel, and on many forms of community, including, of course, education, visiting people in nursing homes, etc. And this had profound implications for religious communities, which had, in fact, already attracted attention as potential super spreaders because of the reality of large religious gatherings. But what this has also highlighted is the relationships which differ so widely across the world between governments and societies, and particularly religious communities, and how this has affected, for example, ideas about the freedom of religion or belief, and the capacity of religious institutions to respond to health emergencies. These restrictions have been tested in many different ways, by law, by demonstrations and riots, in the United States at the moment, even now by truck convoys, which are questioning the authority of governments to restrict movements, to impose, to require mask mandates, to close schools, all of the other restrictions that have characterized this. And I think perhaps none have been as emotional and as difficult for people living through difficult times as the need to close religious worship places and large pilgrimages and other gatherings. So this is a profound part of the COVID experience. Related to the religious gatherings is religious practice. Obviously, we have all shifted rapidly from meeting face-to-face to online gatherings, and that includes, of course, the religious gatherings, which have moved in so many cases online. But for many, that was not a possibility. And so they have essentially been restricted in many ways from the traditional practice, both the regular worship and coming together, but also marking of events, baptisms, weddings, etc. Of these, the most profound and I think the most traumatic have been the restrictions on being with people at the end of life and the marking of funerals and burials. But those are among the many life transitions that have been affected. Many religious institutions have seen their finances challenged. Relationships among people changed as a result of the pandemic. We don't know very much yet, but we can anticipate that there will be changes in people's beliefs. This has been a characteristic of pandemics across history, but we are getting glimmers of what that may mean in the present. The fact that many religious institutions play central roles in health systems has become very obvious. And there are two I's that I think are important to emphasize. The first is huge inequalities that have been so starkly revealed by the pandemic. And secondly, the inadequacy of so many health systems to respond to the needs of people in this crisis, both for COVID, but also for every other aspect of health. And I think a third I is important to emphasize that is another theme we hear time and time again, which is that health is interconnected to food, to mental health, to belief, to psychology, to every aspect of welfare. So those are the sort of religious dimensions per se, the gatherings, but also the challenges and the changes to practice. A third major area is what we can call social protection, which is helping people to cope in an unexpected time of tumult, of turmoil, and of suffering. And religious communities have played extraordinary roles, which will never be fully documented in their full statistical significance, but everywhere across the world, people have fed the hungry, have helped people being evicted from their housing, have provided water, have provided solace, comfort. In many ways, the religious have been both an essential service, something not recognized, but have mobilized at many different levels, from the very, very local to the global. For example, the Religions for Peace has set up a humanitarian fund to support the interreligious councils. But every kind of organization has tried and has essentially pivoted, as we say, moved mountains to respond to the needs of people, particularly the most vulnerable, those who are suffering, refugees and others. So that is a remarkable story of social and political, economic mobilization. A fourth area that is significant, and again, one where we're seeing a very diverse picture. I'm going to be very interested in Peter's comments on this as well. We saw at the very beginning of the crisis two predictions. One was that with this common threat, we would see visions of a common humanity, people coming together, a shared concern. But we also understood from history and from the polarization in the world today that there are wide divides. There is hunger. When people are afraid, they often react in ways that bring out, in a way, the worst angels. We have, of course, seen both. We have seen the call to the common humanity to work together, to support each other. But we have also seen rises in discrimination, of tensions, the effort to find scapegoats, to find someone to blame. And with that, one of the major characteristics, one of the major developments has been the rise in hate speech fueled by social media that has both misinformation, some of it accidental, some of it very deliberate, and conspiracy theories. Most worrying is the anti-vaccination conspiracy theories that have slowed the remarkable progress of vaccination. Some, by no means all, but some of these have a religious dimension to them, either that they spread through religious communities or that they are invoking religious arguments against vaccination, for example, as well, of course, as religious arguments for vaccination. So the tendency to see a rise in social tensions is something that is both a characteristic of some religious communities, but it has also been seen as a responsibility of religious communities to provide the most constructive and accurate messages, relying on their trust, but also to counter the negative that we have seen. The fifth area is conflicts, where we have, in a sense, patchy information and knowledge. In many parts of the world, conflicts have continued, some have got worse. Our information and peace building has often been damaged, has been harmed by the pandemic. So this question of peace, how we deal with fragility, is very much affected by the COVID pandemic, and it very much involves religious communities, both as sources of tension, but also as blessed be the peacemakers. And the final area that I will talk about briefly is what comes next. We are hearing in many different formulations the message that we need to build back better, to recover stronger, to build back fairer, to build back more just, to prepare for the pandemics ahead, to address the stark inequalities that have been made so obvious through the pandemic. So those are, that is a quick summary. They are reflected, many of these findings, in one of the papers that you will find on the websites, but also in the chat box. So with that introduction, I will now turn to Peter Yaboa, who is speaking to us from Accra, I think, who also has lived the pandemic in an important position with his special focus on health. So Peter, over to you, and then we'll hand over to Olivia. And I should say that the bios are available on the website and in the chat function.
Very well. Many thanks, Catherine, for that insightful presentation. And in many ways, your reflections depict the experiences over the past 2 years of living with the pandemic in our response and recovery efforts over there. I would say that on reflection for the past 2 years, the Christian health systems or the faith-inspired systems, which over the years have touted itself as providing between 30 to 70% of health services in sub-Saharan Africa, probably did not realize its unique role, contributions, and challenges. So the 2 years of living with COVID has highlighted the visibility and relevance of religious health institutions. It has also pointed out the inherent needs and systemic challenges of religious health institutions, and highlighted also the prospects and potentials that we have in the overall global health system. And so let me put it this way. what have we done right, or what did we get right at the start of the pandemic? And then later I'll go into probably what we got wrong or what we have realized that is wrong and highlight some of the potentials. And of course, I'll respond to the paradox of religious health institutions, sometimes as enablers and sometimes as barriers, addressing some of the equity challenges that Catherine mentioned. The first thing we observed we did right as religious health institutions that reflect the health and healing arm of the whole Christian religion was the power of mobilization. At the dawn of the pandemic, we realized the need that we have to leverage our convening power access to social spaces. So we brought Christian health associations all over Africa, 40 networks and associations in 30 countries to see how we could fashion out our response to the pandemic. From there on, we also saw the need to mobilize through the communities and the churches. Remember that in most countries like Ghana, about 70% of Ghanaians identify as Christians. So that's a powerful platform. And so we had to bring them together to see how we can fashion out the response. The second aspect of mobilization was how all CHS came together to assess their unique roles and contributions in the pandemic response actions. And then, of course, we realized that resource constraints are there. We need to mobilize resources to address all the response actions, including risk communication, case management, surveillance, contact tracing, and all the rest. But perhaps at the height of the pandemic, the experience, we also saw that the concentration were more at the urban areas. The subnational levels were neglected. And the subnational levels are where many people, probably 70% of Africans live. So it was a clear case of inequity where the city centers with having access to testing were classified as epicenters. And then the rural areas were neglected. So it was a clear case of inequalities or inequities in response action. So we had a duty to target communities, the churches, the rural, the neglected, the unreached segments of the society. I thought that these mobilization aspects was very helpful in helping to support the government that had to really respond to this in leadership. The second aspect was capacity building. Here we were with new pandemics, and we realized that there were gaps in knowledge with respect to triaging, infection prevention and control, and virtually all the COVID response actions were new to the system. So there was a clear case of capacity building. And then recognizing the leadership of government, there was also a case for state-church partnership in health. We understood clearly that government alone could not respond effectively to the pandemic. And therefore, we subscribed to the all of government and all of society approach addressing the pandemic. So we partnered the government in planning, policy, development, implementation. And at a point, we saw also our churches a bit leaderless in terms of how they will respond to this whole COVID response actions. So Catherine spoke of religious practices that had to look at communal, engagement in the practices. And then here we were with social distancing. So we had to help support religious leadership in developing guidelines for even practicing their religions amidst the pandemics that are there. And also helping them to play the advocacy interventions in all the areas that were required. Amidst the pandemic, we also felt that we were probably neglecting essential routine critical health services. So continuity of essential health services was also very important. Probably COVID, as important as it were, may not have been the cause of several deaths in the rural areas. We felt that neglect of essential services was also very important. So we availed our infrastructures for isolation centers, for case management, and also to ensure that basic services like maternal health services were also provided. When it came to risk communication, we felt that we were very much needed. In several countries, we saw polarized response. By polarization, I mean, you had the opposition to the government fashioning out its own response actions, while the government too was also fashioning out its own response actions. So there were mistrust, suspicion, and divergent response to this whole thing. We had an important role to play. We felt that the religious space had key social capital, trust, confidence, rich convening power. So our religious leaders were very vital in risk communication and helping people to comply willingly to the protocols and the rest. So we felt the role of religion in this case was so important. And it also helped with heightened collaboration, exploring new partnership, intra-partnership, and inter-partnership. By intra-partnership, I mean for the first time, you found religious leaders of diverse groupings, evangelicals, and then the Methodists, Catholics, and all of them coming together to pray, to support the government. So we felt that was very much important. And it helped to harness the synergies that were required to respond to this whole thing. Having said all these nice things about what we got right, some of the inherent needs and challenges, which somebody may classify what we probably realized was wrong, with limited research capacity, limited knowledge. We were surprised as to how our experiences with HIV pandemics, Ebola, had not really helped us to document knowledge, practical experience in managing pandemics of this nature. And we saw clearly that research capacity within faith-based arena were very much limited. The emotional response, the over-spiritualization of science was also an issue. Even though at a point we saw cooperation and collaboration, and yet you saw that knowledge among the religious communities and also within faith-based health system were limited. So one key thing is the need for documentation and sharing best practices through research. The second one, as I'll put it, is the paradox of some church or faith leaders fueling myths and misconceptions about the COVID vaccine, which was very much surprising. And it was promoting what some describe as vaccine resistance and hesitancy. You had some people, religious leaders who were trusted, who were using their platform, who were using the congregation that they had to preach against a scientific response to this and characterizing vaccines as the beast or the mark of 666, which was very much troubling. And it was troubling because here we were with leaders who had the platform, the trust, the confidence, and we realized the need to engage our leaders on that aspect. The other thing we realized was that how our entire health system has been couched around treatment of diseases with financial incentives other than holistic public health response. We saw weak health infrastructure. We saw that our entire health system would need to be restructured and to be responsive to the needs, public health needs of us. It was a redefinition of what health means. Is it only clinical? How about disease prevention, promotion, healthy living? Those were very, very much something that we realized that we had to look at. And then, of course, we observe absence or limited competencies in critical areas of intensive care, critical care, infrastructure deficits in other areas. And so for us, on reflection, let me, at this point, respond to Catherine's point about how religion was also scapegoating of religion, as we put it, and also how probably it was also seen as a cause of, of the spread. The diversity in various religious groups itself lend itself to such varied responses. The differences in religious practices, communal worship, and the rest. So you found in many environments where they could not really understand why worshiping God could be individualized. The communals coming together, some of them resisted government protocols, and so indeed it was. But then we also see that religions are usually united but not unified. And so that diversity is which at one point in time is a strength that could be harnessed to respond to situations. At one point it was also a source of confusion, tension, and accusations and counter-accusations. Clearly, diversity is a strength, but it also shows that we have a challenge in harnessing the synergies. So one of the key things we are learning now moving forward is how we can harness the strength synergies of various religions. And as we build capacity to respond to future pandemics, it is very clear that we have to really do internal self-reflection to look at knowledge gaps, look at how our diversity could be a source of strength, how united we are, and yet we are not unified. And the fact that in building a global or continental health system that will be responsive, robust, and resilient, the role of religious institutions is indispensable. And yet, capacity is the issue, conscious awareness of our roles, and also the paradoxical situation we find ourselves is also very relevant. It has been a moment of reflection, and I think it is probably time for us to embrace our role contributions properly with sense of change in the times ahead. Thanks so much.
Thanks so much, Peter. That's fantastic. Olivia, over to you.
Thanks, Catherine, and thank you, Peter. Okay, so the next part is a reflection on the academic research that we've seen come out and we have highlighted in the repository so far. A few things we've said since the beginning. I remember very early on in some of the webinars we did saying that this will be the most researched pandemic that there's ever been. And I think we are seeing more and more research coming out, but of course that took time. So it wasn't appropriate to start research right at the beginning of the pandemic. There wasn't enough information yet. A lot of research had to stop and adapt at the beginning of the pandemic. But however, 2 years in, we are now seeing more and more in terms of academic research on religions and COVID-19, including peer-reviewed original research, books, and publications that meet the kind of academic standards that we've categorized in the repository as academic articles and some of the other types of resources that we have there. So I will go now into a little bit more of a deep dive into what we've seen from the research publications. Recently, we've done a review of 219 articles published between the beginning of the pandemic and up to October 2021 at the end of last year. From those articles, we can see some major themes emerging. Many of them are linking in with what Catherine and Peter have already said. But in order of the most frequent to the least frequent, the major themes have been mental health, government relations and partnerships, technological aspects, digital aspects, freedom of religion and belief, links to gender-based violence, and vaccination. Of course, we probably expect to see some of those changing. So we expect to see more and more on vaccination coming out, and that may move its place in that ordering of articles. We didn't cover more theologically oriented work, but of course there's been plenty of publishing in this area too, theological reflections from all religious traditions on the history of pandemics and the place of pandemics in our current thinking. But broadly speaking, we have found that most of the articles address religion or spirituality, depending on the term they choose, in a general sense. Then the next religion addressed has been Christianity, then Islam, then less on Judaism, interfaith engagements, Hinduism, Buddhism, and indigenous and traditional beliefs and practices as the other article focuses that we had in our review. And this reflects generally, if you've heard us speak before on religion and development evidence, the trends we see in academic publishing in broadly the religions and development evidence base anyway. So the one topic that there was most prominent above all others was mental health, which we've already noted from Catherine's presentation at the beginning. But what I'll do now is focus on the publishing, the articles, the original research that has come out around mental health. So, of course, reports have noted that 1 in 5 COVID patients develop mental health issues within 90 days of testing positive. Couple that with the background research from psychology on religious coping in times of crisis, and it is really no surprise that mental health has been a key topic for academic researchers on religions and COVID-19 response. We found that the articles about mental health and religion really represented a broad global geographic focus. This was not only a focus on the US, for example, or the UK, but we had articles from that had a global reach. We had articles also reporting about the Caribbean, South Africa, Kenya, Nigeria, Brazil, Pakistan, Iran, Canada, Israel, Uganda, Italy, Colombia, Ghana, Poland, Peru, Turkey, Mexico, and Zimbabwe in this mix. So that's a long list, not to remember every single one, but just to demonstrate that this is an issue of concern worldwide. Overall, the studies in the different countries and on different religious traditions have found, unsurprisingly, that positive religious coping, including actively reaching out for spiritual support, fostering social relations through religious practice, attributing meaning to suffering and illness as part of a religious worldview, corresponds to better mental health conditions. While negative religious coping, such as believing the virus is a punishment or experiencing negativity in that spiritual realm of life, have led to worse mental health conditions. So from the beginning, just setting up that there's both the positive and the negative within this world of religious coping that the academic articles are reporting on. Okay, so for the positive coping side, spiritual support can have a significant impact when addressing distress caused by the pandemic at personal and community levels. From one example, from one paper in Brazil, a survey suggested that 75% of participants considered spirituality and religion as important tools to address the effects of social isolation and fear that they were experiencing during the pandemic. In another example from a paper that looked at Pakistan, health anxiety amongst Muslims was also found to be reduced by religious coping, and the authors suggest, therefore, that there is a need to integrate a recognition of religious coping into other mental health strategies. And then amongst Orthodox Jewish congregations in Israel, another paper found that communal practices, even when done online, not in physical proximity, were found to be beneficial to people's mental health in those congregations. Turning next to negative coping. For instance, COVID-19 has been wrongfully described as, and I quote from one of the papers, a deceptive evil from which true faith and trust in God will protect or spiritually vaccinate true believers. So this has been a concern for many of these academic papers and research that's been going on. With some, for example, religious groups framing the pandemic as a punishment for the behavior of what they consider as non or inauthentic believers, and stigmatizing some groups as responsible for the pandemic. Peter and Catherine have touched on this already, but there are plenty of examples from around the world, papers from the US to Iran, of these researchers reporting on religious leaders hampering public health measures. And in fact, that's led many of the researchers to warn that religious coping mechanisms might also be used as a tool to spread harmful messages and manipulate people who are exposed to some of these negative copings and beliefs that are present in religious communities. So the research is blending in this understanding that mental health and religious coping can also have this negative effect that has the broader broader effects on public health messaging and how people are responding in their communities to the pandemic. Of course, we've talked already about adaptations to religious gatherings, etc. But religious communities and religious leaders have also had to adapt how they deliver spiritual support, pastoral support, and counseling to their members. So we found examples, for example, in Ghana, there was a group of religious leaders studied in one particular article that changed their messaging to a more hopeful style of messaging so that people would not abandon or their faith would not deteriorate during the pandemic. Other examples, again, another example from Iran was about religious leaders going safely into hospitals to provide support for alternative mourning rituals. But of course, we've also seen that there were several reports of a lack of systematic and integrated support for healthcare workers, chaplains, and other people to provide spiritual support and religious assistance, especially during the beginning of the pandemic. And technology is also one of the areas that has helped people change how they deliver that spiritual support. Many reports of the use of YouTube, Facebook, Zoom, etc. For instance, a survey amongst pastors in South Africa showed that 89% of participants use social media and 78% use their phones to communicate with their congregants. With the study also showing that 70% of church members had asked to meet their pastors for counseling, demonstrating the significant role that religious leaders and communities can play in supporting people's mental health through that spiritual support. So overall, from the research, we see that the effects of religious beliefs and practices are not only positive or only negative. Instead, the examples are demonstrating a complex intermingling of coping strategies, where religious beliefs and practices can sometimes simultaneously both support and then undercut a believer's mental health. In one example from Poland, we saw confusion amongst religious believers and their coping strategies about who they should trust in terms of the authority figures, where public health authority figures were delivering messages that were different to religious authority figures. And that created confusion and anxiety. So in fact, increased people's anxiety and lack of support, in fact, in their appreciation of messaging around the health measures in the pandemic. So this also demonstrates that we cannot isolate religion and mental health as discrete categories because of the political, cultural, and social issues that are also heavily influencing both of these domains. Even further, we must be mindful to take an intersectional lens to understand when identities from gender to age to race and ethnicity are affecting how people use their religious beliefs and practices as coping strategies. Possible lines of future research could help develop a better understanding of the impact of interwoven positive and negative religious coping strategies in mental health. But I think also I want to highlight that some of the work that we did this time last year, so 1 year ago, when we were working on the 1-year retrospective, was to develop a faith and vaccines matrix set of questions for analysis, or a matrix as we called it. And I'll post that in the chat after I'm finished speaking. But that was a relevant tool, still up to today, still relevant and it has many questions that can be asked if you're thinking through what do we want to know more about and what can and should we know more about in terms of research and building the research base on religions and COVID-19. Okay, so that's the end of my deep dive into some of what the academic research is reporting at the moment. Of course, this is a moving area, so we hope to be able to keep updating you as we go, and of our weekly emails as part of this project will continue to include reports from the academic research as well as other sources. But to talk more broadly about the repository now and to introduce you to the new website, I am going to turn over to Ruth. If you're ready, Ruth, go ahead. Thanks.
Great. Thank you, Olivia. Yeah, hi, everyone. I am going to do a deep dive into the new repository, which we're very excited about. Everyone, Catherine, you can hear me, right? I think it shows that it's still on Olivia. I'm not sure why that is, but I'm glad everyone can hear me. Yeah, so I'll talk about the repository, but first I want to back up and explain a little bit about how we got there. I'll give sort of my COVID story, as Catherine mentioned at the top of the program, the story that I'll probably be telling my kids and grandkids one day about sort of where you were and what was happening as things started to shut down in March 2020. So I remember being in Catherine's office, I think probably around March 9th, not more than a few days before March 11th. And Catherine proposed that we convene a group of practitioners to discuss the emerging news about this coronavirus, that we were hearing in the news stories. And 2 days later, which happened to be the very last day that we were in the office, as was just posted in the chat, my day job is the events manager for the Berkley Center. We sat down with maybe 10 or so people in the room, in our conference room at the Berkley Center, and 10 or so more people joining via video conference to explore faith engagement in, well, at the time it wasn't even yet a pandemic, but what became the COVID-19 pandemic. And that was the first time that I had ever set up a hybrid meeting. It was not the last. It was the last time that I ordered coffee for an event. So just those details, I think, really show how much things have changed over the past 2 years. Now I'm very proficient at setting up hybrid events and not as proficient at ordering coffee. We received the official email from Georgetown University practically at the same time as the meeting, telling us to go home and plan to work remotely for 2 weeks. That turned into 2 years. And the central question that was explored at that meeting was, how will religious communities contribute, both positively and less so, to the ongoing COVID-19 pandemic? And it was declared a pandemic that very same day. From this meeting, the Religious Responses to COVID-19 project emerged, which both Catherine and Olivia have discussed, which is a joint collaboration between the Berkley Center at Georgetown University, the World Faiths Development Dialogue, and the Joint Learning Initiative. And after I finish speaking, I'll post some links in the chat to sort of the overall project, and Olivia and Catherine will also speak a little more about some of the project outputs besides this repository, which is sort of the main thing that I'll now focus in on. So one of the first activities of this project was to just start compiling every resource that we could collectively find that related at all in any way to religion or faith and COVID-19. And we started cataloging these resources in a public Google document that was loosely divided into global, country, and local responses. The categories and languages and everything else sort of just exploded and grew as it became clear that the pandemic was an ongoing long-term crisis. And efforts to collect resources began to redirect towards coverage of sources of potential relevance to global health and international development, and to the diversification of sources from a wider range of languages, countries, and topics. By the end of by the end of 2020, the document had grown to over 100 pages of links to resources about faith and COVID-19. And it became clear that a Google document was growing larger than was useful to be user-friendly. So we then began discussions about how to catalog the hundreds of resources that we had already collected and present them in a way that would be conducive to long-term learning. At that point, it was very clear that, as Olivia said, there would be a lot of long-term research on this topic, and we wanted to be able to contribute to that. So we worked with amazing partners from Data Science for Sustainable Development, DSSD, and we made decisions about the format of the website and set up a search form. Each source that we had then collected had to be coded in a way that would allow us to both take stock of what we had already collected and easily add new sources as we continued to grow this database. With the help of a wonderful team of interns and contractors and all of us on this team, and the support of the International Partnership on Religion and Sustainable Development, PARD, we undertook this task and we coded over 1,000 resources using the guidelines that I'll share now. So I'll share my screen to the website. And again, I'll post this link in the chat if it hasn't been posted already. So this is the website that we were able to set up. This is everything that was originally on our Google document, is now on this website. And if I go over to the methodology page, this is some of the background that I just explained. And if you look at how to understand the repository categories, these are the decisions that we made as we were coding these resources. So you can see the guidelines that we were following as we coded all of our resources. We chose what type of resource it was. We chose which region the resource was about, and the country that it was about. We chose the language that the resource was published in. We chose the religion, and this was one of the hardest categories to make decisions about because it's very hard, as Olivia can tell you more about if you ask her sometime. Religion is a very hard category to code. So we did a lot of thinking about this, and these are the decisions that we made about which sort of overarching religions to use. And then we also decided to include a sub-religion category that is coded using whatever the article or resource itself identified itself as. So if the article mentioned that it was about evangelical Christians, then we coded it as evangelical, or Sunni Muslims, we coded it as Sunni. So that was our way to sort of take into account that there are a lot of different denominations. And that is also, when I show you the search form in a moment, you'll see that I don't think messy is a great word, but it's the subcategory that has a lot of different tags, some of which may belong even together, right? There will be ones that say like Orthodox Judaism or Hasidic, which some people may say is, pretty much the same thing. But it's because we were using, again, those identifying characteristics from the resource itself, just to make sure that we were really capturing how people were self-identifying. And then the thematic areas, the tags. And this is also a place where we spent a lot of time thinking about, okay, what is going to be comprehensive? How are we going to capture everything that's going on? And how are we going to set up categories that will also be useful going into the future? Again, we were having a lot of these conversations in early 2021, and there were still a lot of unknowns at that point about how things were going to evolve. There still are now today. And we do plan to continue to have these conversations and to think about whether there are other tags that we might need to add in the future. But I think we came up with a pretty comprehensive list so far. So with that, I'll turn it back to the actual repository itself. So here you can see we have 183 pages of these links to different resources. It starts with the most recent resources. And then if we click back to the page 183, you'll see resources from 2020. But the most useful way, I think, to use this resource is through the search form. And this is how the search form works. First of all, the keywords, I'm sorry, I don't know why I'm getting an error message, but the keywords field is probably actually not the most useful. The keywords will only pick up keywords that are in the actual title of the resource. So that's just something to keep in mind, and maybe we'll even add a little disclaimer letting people know that. But the best way to use this is by searching for the dates that you want, by searching for the type of resource that you want, the country, the religion, and then the tags. The tags are really where I think you can find some interesting things. So let me walk through a couple of examples. Let's say I want to find a policy brief about gender. So I'll go to resource type. I will ignore the fact that there is an error message, which I will fix later. And I will go policy brief, and then I will go down to tags and gender. And then hit submit. And now we see we have only 2 pages worth of, these are all policy briefs about gender. So we'll see there's one from the Vatican, one from the Berkley Center, ACT Alliance, UN Women, Search for Common Ground. So you can see we have a lot of really interesting things to look at there. Let's try a research report, which the difference between policy briefs and research reports we decided was sort of came down to length, and research reports we said would be something longer, policy briefs are shorter, also which audience it was directed towards. So let's say we want a research report about freedom of religion and belief, FORB. And now we have research reports on freedom of religion and belief. And you can see there are some that are sort of overarching, and then there are others that are more specific to specific countries or communities. And then the last one I'll show you is, let's look at a specific date range. So say I want to find resources from early in the pandemic. I'll go to March 2020. And let's just do the entire month of March 2020. I will say that there's a lot of resources that came out in March 2020. So it's probably going to turn up quite a number of results. And let's say we want to see what kind of guidance documents were coming out in the early pandemic. So March 2020 guidance documents, and then let's say we want to look specifically at guidance directed towards Christians. Oh, sorry, I had FORB still clicked. Let me change that. So here we have all of our resources from March 2020 about guidance for Christians. So, you know, sadly, there's a lot around death and funerals, guidance for churches, safe mass gatherings, things like that, pastoral leadership and changing practices. As Catherine mentioned, was a very clear theme from early on. And now say I'm interested in looking at a different religion. Let's see what type of guidance was directed towards Muslims in the early pandemic. So here we have, again, a lot around funeral issues and some other issues about closures and things like that. Yeah, so I think, you know, hopefully this is a really useful resource for people as they continue to track the ongoing crisis and as more research emerges. As Olivia mentioned, we're seeing a lot of that start to emerge. And we do hope to keep this as a, you know, sort of living, breathing database that we are updating on a regular basis. And I'll just point out before turning back over to Olivia and Catherine, a few other features. So one thing that we also started doing very early on is we started sending out highlight notes of some of the things that we were collecting. And we sort of just chose some of the most interesting resources that we had collected from originally each day. We were doing them daily to begin with, and now it's every week. And you can sign up to get those right to your inbox. But you can also just check this page, and this page is continually updated and has all of the latest highlights from each week. And I think it's also interesting that this has also now collected everything that we were sending out all throughout the last 2 years. So you can look back, and again, this is sort of just a way of saying, okay, what were we sort of noticing back in March 2020? And you can see all of the different highlights that we sent out in March 2020 and April 2020. And you can see how things sort of evolved even back very early on. And then, of course, you know, if you look in 2021, you'll see a lot of messages about vaccines and vaccine campaigns. So I think it's a really interesting way to just kind of take a quick look at what we were noticing over the past 2 years. And the last thing that I'll point out before turning it back over is just the quick links on the sidebar here, subscribe to highlights, as I just mentioned, and then the resource submission form and resource corrections form. This is to submit resources to our repository. And as I said, more resources are emerging every day, every week. We want to capture those, and we want to continue building out our repository. If there's something even from earlier on in the pandemic that we weren't able to capture for whatever reason, please send those to us as well if there's something you notice that is missing. We, as I said, had an amazing team of staff members and interns and contractors who worked very hard on this, but mistakes are made, and it's over 1,000 resources. So if you notice that dates are wrong or tags are wrong, or anything else that can be corrected, please also let us know. We're happy to make those corrections. And then just a general feedback form if there's anything sort of overall on the website that you notice that needs to be updated or changed, or if you have suggestions or questions, please feel free to utilize those links. Thank you so much, and I'll turn it back over to Olivia.
Thank you very much, Ruth. So as you can see, there's a wealth of resources and options for you to explore the repository. Some other outputs of this project have included webinars and blog posts. We've had 18 webinars, making this the 19th. And over 31 blog posts. So we've had a broad variety of people speaking to the question of religious responses to COVID and writing on this question too. And the wealth of information that we've been able to build up over these last 2 years is exciting for us. And also we see that it's having a greater impact as others are reporting on it and using the repository as well. So I think for now, what we're going to do really is turn over to the Q&A. We invite anyone to use the Q&A function to submit questions. Because this is a webinar, we can't unfortunately open the floor for discussion as much, but if you submit your questions on the Q&A function, we'll be able to read them out and respond. So any questions for Catherine or Peter on what they've spoken about, anything on the academic publications that I've spoken about, or any questions for Ruth about how to use the website. There's a link to the website in the chat, so you can already go and look at that. And Ruth just put it up again in case you've lost it in the chat in the meantime. So you can go and look at that and see if anything's coming to light. Of course, we welcome feedback on the website as well if you find anything, and there's the feedback form that Ruth highlighted for any updates that we need to make. But yes, we're open to question and answers now. And I will wait to see if anyone puts them in the chat or on the Q&A function.
There's been a conversation in the chat about some of the issues of knowledge and evidence that I think is worth commenting on. Clearly, we've been quite diverse in the kinds of information that we've collected. And many of the articles have appeared in newspapers, a very wide variety, a lot of gray literature. We did require that things be published before we put them in the repository. We've been very interested in sort of recurring themes and changing themes. I think one, just to give you an example, one very striking set of information that's come out recently is about the numbers of children in the world who've lost caregivers. The numbers now are estimated at well over 2 million. And learning again from the responses to the HIV/AIDS crisis, we know that we need to look at the issues of orphans and the ways in which communities respond. So that, I think, is an especially important issue. I think we've touched on but not highlighted the many gender issues. And really, Olivia and I, from the very beginning, we have broad interest in development and what religion brings to development. So we've been very much aware that every development issue has come into play during the COVID crisis, whether it is water or domestic violence, which is worse. So many issues around healthcare, obviously, which Peter has highlighted, but also education. The estimate that some 1.6 billion children have been out of school, some of them for close to 2 years. And what that shows in terms of inequalities in education, quality issues, the basic purposes of education, but also how do you deal with the gaps that have now been created. So this question of the enormity of the impact of the COVID pandemic is one that we are acutely conscious of. Another area that has been one we've tried to look at, but it's obviously very difficult, is where public policy, public health policy, has failed to take into account the religious dimensions. We're seeing that quite consciously now on the vaccination issue, that quite often the religious roles in both positive messaging on vaccination, but also on countering misinformation, has not been seen as central, whereas it is, of course, our view that it is a vital part of the global strategy. And we all know that until everyone is vaccinated, none of us are really safe. So those are, I think, some of the many points that come up. How we're dealing with domestic abuse. Is that part of mental health or more broadly? So Olivia, are you seeing any questions? I was just waiting for the questions to pour in.
And we've got one question from Marianne Hamilton. He says, is there a complementary repository for mental health information, guidelines, policies, and studies formulated during these years of COVID? So you can, of course, search our own repository on the theme of mental health and find the intersection between religion and mental health and the guidelines and policies there. As for other repositories, there may well be more. But we have not been working with those other repositories just on mental health. So I would say that might be possible, but I'm afraid we don't know. But we have quite a lot of material on our repository at the moment covering that topic. Ruth, anything to say?
Yeah, just to add, I looked quickly, it looks like we have 175 resources on mental health, if you search for that tag specifically. And some of those might also be databases about mental health that we've linked to our own database. And if there are ones that we haven't captured that other people know about that relate to mental health and faith or religion, we would certainly want to capture those. So please feel free to send them to us.
Peter, go ahead.
Yeah, so if I may contribute to the knowledge issue that Catherine spoke about, from where we sit as Christian health providers and living through the pandemic, the relevance of knowledge is felt at this level where barely 30% of Africans or people living in sub-Saharan Africa have had one dose of the vaccine. Don't talk about second dose or booster dose. partly not because of supply issues, but it's because of misconceptions, hesitancy, and resistance about it. It emphasizes knowledge, the essence of relevant knowledge. Very, very important. So probably if we can contextualize knowledge, we're looking at knowledge that would spark appropriate behavior in terms of compliance, or knowledge that would really help in the fight against COVID. The second aspect of knowledge is the technical competencies, where in the midst of the pandemic, we realized our limited capacity in infectious disease management, disease surveillance, and triaging, infection prevention control. So knowledge is as relevant as it is. And then the other point is where we're seeing the number of healthcare workers being infected with the pandemic and dying, all because many people did not know the routes of transmission, the several pathways of transmission. So just to emphasize that we have local knowledge, which is really owned by local people, but the knowledge in terms of technical competencies relevant to the pandemic management remains an issue where capacity needs to be really enhanced. So just to reinforce Catherine's point, that fighting the pandemic is not only a supply chain issue, but even it is about behavioral change, which is facilitated mostly by relevant knowledge that is available and acceptable, and that is age, sex, and then culturally appropriate at any point in time. I thought I should compliment Catherine's point about knowledge. Thanks.
One thing we are hearing from many people is that the COVID crisis in some places at some times seems like the #1 issue on any agenda. But in most of the world, given how this storm comes and goes, Omicron, Delta, vaccination, etc., it has to be seen in the broader context of people's lives. We heard so often in the early stages when there were the lockdowns that people said, well, I have a choice of staying at home and starving or going out to work. And we've seen in that way, the inequalities within countries as well as across countries. So we know now that in order to be successful with vaccination campaigns across the world, but we're looking at Africa right now, it has to be seen in the context of the health system and of people's survival mechanisms overall, because it's not simply about COVID. It is about so many other challenges and issues. So it is this context issue. Context matters, as we all know, that is so important. So we do have a couple of questions now. So Olivia, do you want to take the first?
Well, I'm just going to read them out and then we can answer. So from Lachlan, we have, in the Paul Farmer language of accompaniment, people often don't appreciate that he stressed that it's also crucial to activists accompanying each other in their work. If I'm someone struggling with a local challenge, are there ways I can find other people who are struggling with a similar challenge in another setting so we can learn together and support each other, including with mutual moral support? And then it says anonymous, what differences, if any, have you seen in the role of religious institutions in low or middle income countries and high income countries? Catherine, do you want to answer those and I can add some more? Yeah.
Interesting questions, both of them. I think that this question that Lachlan is asking about accompaniment and about common responses does bring us to the dilemma that we've been aware of from very early on between the sense of a common humanity, of the need for us to see ourselves as facing the same storm. As people said early on, we're in the same boat, but then many other people said, no, we're not in the same boat. Some people are in yachts and some people are in driftwood or in tiny little barks. We've seen many inspiring examples of people coming together, particularly at the community level. And I think that that is a source of inspiration. And sometimes I think, in fact, an observation from Religions for Peace and the Secretary General Asa Karam is that we've seen less interreligious cooperation than we might have hoped in many parts of the world. We're seeing it in some places, and clearly the interfaith organizations like Religions for Peace have tried to respond. But often when you look, it's not been different religious communities working together. It's been everybody in the community, civil society. Geneva is a remarkable example of that. And I don't know if Peter will later want to add to that. But coming to the second question, it's hard to say. I don't think we've seen patterns necessarily by country income level. What we are seeing is different levels of awareness of the religious dimensions in different countries. In some, it's been very much at the forefront where, for example, there are ministries of religious affairs, or where you have very high, as the measures are, religiosity. How important is religion to individuals? In many of those countries, you've seen the responses coming from religious communities. I know we've been struck in Senegal that the interreligious community has worked very closely with the government from very early on to try to deal with the COVID pandemic. And this is true in some other parts of the world. Indonesia is another example. In other countries, perhaps in Europe, for example, we've seen less obvious responses. And we are struck sometimes that we will see, even in the United States, which is a religious country in many ways, that the religious dimension has not been prominent in the public policy response, that people sometimes don't quite know how to take the religion into account. So I'm not clear in my own mind that I see divisions by income level as much as by the historic ways in which communities have worked together. And one lesson that I know we see in many, many places, in many communities, is that where there has been previous experience, there's been a more active and more prompt response. So, for example, the countries that suffered through the Ebola crisis have been much quicker to recognize the need to work together and for religious communities to be part of that.
Yes, so what we saw, for example, the point I was trying to make earlier was that when we zoom in on a topic like mental health, religion, and COVID-19, many of the issues are similar in a broad sense, then with contextual specificity depending on the history of the country, the politics of the country, other cultural elements and social elements happening in the country. So it's not broken up in terms of the economic categories that we have there. It's similarities that we can see in terms of the broad thematic level topics that we might want to look at, which are pertinent for everyone. So around the world, mental health, religious coping is pertinent. But then when you look at the specifics, there's going to be different elements of how that manifests itself from place to place, depending on the context. Peter, do you want to mention anything on either of those points?
Yes, very well. On the first question of accompaniment, how accompaniment or support helps with coping, in support of Catherine's point. One of the experiences we had in Ghana or in Africa generally at the start of the pandemic was the issue of stigma, discrimination, prejudice associated with it, and people seeing the pandemic, the moment somebody tests positive for COVID, everybody felt that it was a death sentence. People were shunning people who are tested positive, people were losing businesses at the start. So it was leading rather to more spread. But then the game-changing thing came in when a famous religious leader tested positive, followed by a minister of state, and all of them came forward and acknowledged that they are COVID positive, including a member of the government cabinet. Then suddenly, and then they were able, within 10 days, they were back. The Minister of Health tested positive, several heads of agencies tested positive, and then suddenly they got well, came back. So it normalized COVID, humanized the response, and that act of solidarity, that openness, rather mobilized public action, say, well, COVID is not a death sentence. So they could identify with suffering, they could also see the end of suffering, they could also contribute to that. So I'm thinking that definitely where people champion certain causes, when religious leaders come in, they provide source of comfort, hope, help, and healing, and it has a way of improving even the mental responsiveness to this whole thing. So it is, accompaniment is very important, so also is solidarity, and that support that are needed to promote compliance with all the protocols. It normalized COVID and humanized the responses and build that sort of communal support and societal interest in defeating COVID as a common pandemic that needs to be addressed. So that is in support of that, destigmatizing COVID response through acknowledging COVID by eminent people, public figures, religious leaders, and the rest, made it quite easier. And even when it came to the vaccine uptake, the first people that took the COVID, took the vaccine were religious Catholic bishops, the president, and people. It helped some people to really respond to the uptake in rare hand. Accompaniment necessary, it helps solidarity and support COVID response actions in broad sense. Over. Thanks.
I think that the question of the diversity of religious responses should never be forgotten. Obviously, we're looking for patterns and we're looking for trends. We're all very interested in this challenge that we put in the beginning. How will this COVID pandemic, which is so extraordinary, change our lives as we look forward? But the diversity is, it comes out time and time again. If you look at the repository, you'll see that. And I'm struck the Catholic Church, which I don't think we've highlighted here, particularly the Pope himself has spoken constantly and in support of action on the COVID pandemic and in support of action, of support at the community level, but also support of vaccinations, et cetera. And different religious leaders have really been, many of them, very courageous in setting an example and working. So have the big NGOs, the operational NGOs, and they have had to cope and to adjust. So in many ways, one of the issues these days is to increase the role and recognition, but also the agency of local faith communities. And that has been forced through the COVID pandemic because people could not travel. And so in many ways, I think we're hoping that we will see a more emphasis coming out through these local communities, but also, as Peter was highlighting before, knowing more about some of the capacity gaps because they've been, we've seen them as a witness. Early on, Pope Francis established a Vatican COVID Commission, which did a great deal of work on many aspects of the COVID crisis. And through the entire network of 1.2 billion Catholics across the world, there has been a genuine effort to mobilize and to bring issues out. So I think that the same could be true of many other denominations. The World Council of Churches, the ACT Alliance, a number of these have really shown remarkable leadership at the global level, but also at the local level.
Okay, so we have a few comments in the chat. Joan is picking up on comments about previously how we have not stayed focused on tackling some of the most fundamental issues when everything shifted to COVID and other buzzwords that have been prominent in the last 2 years, and asking how can we stay focused on some of the core challenges, the most fundamental of challenges. And then Marie-Anne Hamilton is asking about the significant effect on families in particular, focusing on family issues as important as spiritual and health issues and other issues. We've only got, I mean, I think those are more comments rather than questions at this stage. We're starting to wind up this panel for now. This is part of a series. There was a webinar last week that reported on the findings from research with 8 faith-based organizations and their COVID response that touched on many of these points similarly as well. Their need to establish partnerships before a crisis rather than during a crisis, the ability of local faith communities that had already been working in an assets-based approach to respond quickly to the pandemic and changes happening. We have another webinar coming up on the 1st of April. A link to that will be put in the chat now as well. The 1st of April webinar is still in this mode of retrospective reflection, and we'll be reaching back out to many of the regional and national faith actors that we spoke to in the webinars in 2020 to hear their updates 2 years down the line. We'll be posting more about the speakers, and if you're on our email list, you'll get an update on the speakers in due course. And then there'll also be a webinar on the 29th of April that will be specifically focusing on this question of localization, local faith actors, and COVID-19 response, with, again, a different set of examples that we'll update you about through email in due course as well. So we hope to see you on the 1st of April event for the continuation of this webinar series. In the meantime, thank you very much to Peter for joining us today, very much appreciated. And a big thank you from our team, Catherine, Ruth, the people behind the scenes, Rima, Sarah, who couldn't join today, everyone that helped us with the repository, Susanna, Chika, the DSSD team, etc. We're all very grateful to get us to this point. So I think for now, we'll be signing off, saying see you next time.